The UK is in the midst of a social and economic crisis, and this time the NHS nurses are on strike.
We see nurses who have children mainly going to food banks.
We see so many children in poverty every day in A&E.
We're watching the disintegration of our public sector.
It's like a warlike situation where you constantly put mental stress on yourself for 12 hours in a row, and I couldn't do it anymore.
Amongst the discontent of a country whose inflation keeps on growing, even emergency departments, including intensive and cancer care, have joined in on this strike.
We are the NHS!
In London alone, there are over 12 picket lines at various hospitals. The Real News Network was on the streets to speak to workers at picket lines across the capital.
What you're seeing now is an outpouring of disdain and distrust for the government. They've made cuts to our bursaries, cuts to our services, cuts to our pay, 20% lost in real terms over the last 10 years under this Tory government.
So 75% of my shifts are understaffed. I often get asked to do double jobs, running a shift and taking care of patients. I'm not enabled by the system anymore, by the NHS, to take proper care of my patients.
A very clear demonstration of the way that we aren't able to give safe care is the number of nurses that we are currently under-recruited by. 47,000 at the last count. 47,000 nurses that are nowhere because people have left after the pandemic, because young people are not able to get bursaries or funding to study nursing, and people don't want to come into nursing because actually it's a very difficult profession to be in. It's under-recognised, it's underpaid.
People are leaving to go and work somewhere else where they're going to get more money, which is a massive loss. And a lot of those nurses are very skilled nurses who, we need to support the junior nurses.
It's sad when I kind of tell my colleagues, oh, I'm starting my course to train to be a nurse in September, and they're saying, I can't see myself doing this for more than 5 years, kind of good luck to you. It is sad knowing that people who used to love this aren't doing it anymore and they're going to leave.
The government have offered the nurses a 5% pay rise. Whereas some unions have accepted this offer, others reject it and vow to continue industrial action.
I would love for this to end. I can't believe I'm here back on the picket line today after the talks and the offer. It's so tragic that we're actually outside here today. I don't want to be out here, I want to be in there looking after the patients.
I'm a critical care nurse, so I look after people in intensive care. I look after people that have just had cardiac surgery. And the compromises that I'm seeing now are putting patients potentially at risk of catastrophic injury or death. And it breaks my heart to say that in the 6th richest country on the planet in the 21st century, the care in our health service is being so compromised by cuts and the Tory administration that we have to go on strike to try and get pay restoration.
Care is very broad, but it's looking after your patients, being there after their surgeries, before their surgeries, supporting them through an emergency department, supporting them through end-of-life pathways and letting them die in a compassionate way. We have differences in that. We're seeing it often that we're not giving that care anymore, and that's what's really hurtful as a nurse. I didn't go through 3 years of education and register as a registered nurse to give that care.
We are the nurses! Mighty, mighty nurses! Mighty, mighty nurses! Keep our NHS alive!
Absolutely. I've been on the, not the tannoy, that's in A&E, the megaphone today.
What do we want? Fair pay! When do we want it? Now!
They feel like the NHS is being pushed into privatisation, but I don't want that to happen. There are so many patients that wouldn't be able to afford the basics of care. I suppose my great-grandma was poorly over Christmas, just before Christmas, and she was in A&E in a Kent hospital. I won't name the hospital, but in Kent somewhere. She was in an A&E, and she was there for 2.5 days on a ventilator. before getting to a ward. Like, that is how bad, that no one of any age should have to stay in A&E for 48 hours plus before they can get a bed on the ward. And the beds were everywhere, the whole A&E was piled up. It's not safe for the patients. There's no way, if there was an emergency, they couldn't get an emergency trolley and a defib to the patients in the second row.
I'm an RCN member and I work bank. I retired early at 65, actually, because I was no longer prepared to carry the can for unsafe conditions.
Safe staffing saves lives! Safe staffing saves lives!
The shortages are so severe that I'm continuously asked to come and help out on ward. Morale is at rock bottom. The only thing that's sustaining us at the moment is the unity among people who are campaigning to improve conditions. But other than that, it's appalling.
No NHS! No NHS!
Previously, years ago, we didn't strike because we felt we had a duty to our patients to not strike, to say. Now it's the converse. We have a duty to our patients and to our public to strike in order to highlight unsafe conditions.
Thank you so much for watching the Real News Network, where we lift up the voices, stories, and struggles that you care about most. And we need your help to keep doing this work, so please tap your screen now, subscribe, and donate to the Real News Network. Solidarity forever.